The broadcast is now starting. All attendees are in listen-only mode.
Hi everyone, welcome to the webinar. My name is Priscilla Huang. I'm from the Asian and Pacific Islander American Health Forum, and I'll be the facilitator for today's webinar entitled, What Does Going Over the Fiscal Cliff Mean for Asian Americans, Native Hawaiians, Pacific Islanders, and Their Health? This webinar was organized by members of the National Council of Asian Pacific Americans, or NCAPA, which is a coalition of over 30 national Asian American, Native Hawaiian, and Pacific Islander organizations. Based in D.C., NCAPA serves to represent the interests of Asian American, Native Hawaiian, and Pacific Islander communities and provide a national voice on issues that impact our communities. So today's webinar is the first in a two-part series focused on the fiscal cliff. NCAPA will be hosting another webinar tomorrow at 1 p.m. Eastern that will focus on the impact that the fiscal cliff will have on housing and other social safety net programs, and we'll provide information on how to register for that later in the webinar. But before we begin, I'd like to take care of some housekeeping items. First, please note that this webinar is being recorded and will be made available on the Health Forum's website in the near future. All participants are currently muted and on listen-only mode. We will have some time at the end of the presentations for question and answer. However, due to the number of participants, we will not be able to unmute individual lines. Instead, we will be providing instructions on how to enter your questions into the question box located in your sidebar, and I will direct them to the appropriate speaker. So you've probably heard a lot in the news lately about the looming threat of a fiscal cliff, along with dire forecasts about what it would mean for our economy. But do you know what the combination of tax increases and spending cuts would mean for the health services and programs that serve Asian Americans, Native Hawaiians, and Pacific Islanders? On today's webinar, we'll talk about the fiscal cliff, what it is, how we came to where we are now, and talk as well about the implications it could have on federal, state, and local health programs. First, before we do that, I'd like to introduce the speakers. So up first, we have Paulo Pontemayor, the Government Relations and External Affairs Advisor for the Asian and Pacific Islander American Health Forum, a national health justice organization which influences policy, mobilizes communities, and strengthens programs and organizations to improve the health of Asian Americans, Native Hawaiians, and Pacific Islanders. Prior to working at the Health Forum, Paulo worked as a senior legislative assistant for U.S. Representative Madeline Bordallo from Guam, who served as the executive board secretary and chair of the Health Task Force for the Congressional Asian Pacific American Caucus. Paulo also managed the Congresswoman's environmental and natural resources work on the House Committee on Natural Resources, where she served as a senior member. Additionally, Paulo was responsible for her education, civil rights, immigration, women, children, seniors, and families initiatives. And Paulo also served as an APEX fellow with U.S. Representative Xavier Becerra, where he worked on education, housing, commerce, and budget issues. Next, we will hear from Mr. Jeffries Caballero, who's the Executive Director of the Association of Asian Pacific Community Health Organizations. And he's been with the organization since 1993, where he advocates for programs and policies that increase access to high-quality, comprehensive community health care services that are culturally and linguistically appropriate. Mr. Caballero participates on numerous national committees that address issues facing Asian Americans, Native Hawaiians, and other Pacific Islanders, such as tuberculosis, hepatitis B, diabetes, and cancer. His work experience encompasses a variety of fields from grassroots organizing, health education, and primary health care. In addition to his work for APCHO, Mr. Caballero has served as Vice Chair of the National Viral Hepatitis Roundtable, Board Member of the American Diabetes Association, and is a past member of the National Diabetes Education Programs Executive Committee. Next, we were originally going to have Ms. Hirota, who's the Chief Executive Officer for Asian Health Services, but she unfortunately can't make it to the webinar. So in her place, we have Christine Soyo Harley, who plays a leadership role in APCHO's Washington, D.C. office to implement administrative, legislative, and political advocacy strategies in order to improve the quality of life for medically underserved Asian American, Native Hawaiian, and Pacific Islander communities. Chris has extensive program and policy advocacy experience, having worked in nonprofits and state agencies on issues of healthcare, immigrant rights, and economic justice for over 10 years. And last but not least, we have Shyvana Jorawar. Shivana coordinates the organization's reproductive justice policy priorities. She's passionate about uplifting the status of women in communities she identifies with and has a background in legal advocacy and community education around issues of gender-based inequity and violence. Her experience includes working with the Equal Employment Opportunity Commission as a legal clerk, working with the Anti-Domestic Violence Organization for Saki for South Asian Women, co-chairing a chapter of Law Students for Reproductive Justice, and co-founding the Indo-Caribbean Women's Organization, Jahaji Sisters, where she's now a member of the steering committee. Without further ado, I'd like for Paulo to start his presentation.
Thanks, Priscilla. So I'm going to go and give a brief overview of some of the main pieces of what this fiscal clip is all about and kind of tie that into how it will affect the AA and NHPI community and their health. And so next slide, please. Just want to start off by looking at this question of what is the fiscal cliff. So this fiscal cliff describes a scenario in which by January 1 of 2013, a set of expiring tax provisions and the effects of the Budget Control Act, which were passed in 2011, will take effect. Congress has until December 31st to work and to craft a compromise to avert these cuts and tax increases. Right now, there has been two main proposals offered by President Obama and Speaker of the House, John Boehner, and these are the two main modes of averting the fiscal cliff. Other legislation has been introduced to propose, but they only mainly address either the tax issues or the Budget Control Act provisions surrounding sequestration, and none has emerged the same visibility as these two previously mentioned plans by the President and the Speaker. According to the Congressional Budget Office, the cuts in tax increases is equal to about 4% of the gross domestic product, which is more than enough to throw us into another recession. Next slide, please. So the impact of the tax increases, and these are the part of the fiscal cliff debate that gets most of the attention. And it's no surprise because these are the provisions that are seen as affecting the most people as it directly relates to their pocketbooks. So if nothing is done by January 1st, 2013, middle-class American families on average will see their taxes go up to $2,200. And these 5 tax cuts that are addressed are all related to the 2001 and 2003 Bush tax cuts, the 2009 stimulus package, which include the Earned Income Tax Credit expansion and the American Opportunity Tax Credit, the payroll tax holiday, which is related to Social Security taxes, the alternative minimum tax, which is something that Congress works on annually, and a whole package of different tax extenders that Congress also works on an annual basis. According to reports, letting these 5 tax cuts would save the federal government around $550 billion in 2013 alone. At the same time, analysts also predict that unemployment would rise by almost a full percentage point with a loss of about 2 million jobs, according to different reports based on whether or not these tax hikes are averted because of the pressure it provides for small businesses and different industries. Next slide, please. So the other part of the fiscal cliff that not many people are talking about is the provisions related to the Budget Control Act. If we remember what happened last year, a new entity called the Super Committee was formed to try and work out a compromise to both lower federal spending and to get the country working to not increase the federal debt. It was no surprise that the Super Committee failed to come up with a compromise. And because of that, this automatic sequestration process will happen that cuts non-defense discretionary programs, which is everything that isn't related to the DoD and several certain other programs related to energy and other pieces. And in 10 years, this will result in $1 trillion in cuts spread across the whole federal government of discretionary spending. So to put all of this into perspective, before sequestration, non-defense discretionary spending, so everything other than the Department of Defense, was lower, and this has been the case since the Eisenhower administration. It is also true that we could cut all of the non-discretionary defense spending entirely and still not balance the budget. So the conversations about continued cuts to the federal government will not be enough to get the balanced budget approach that many pundits are talking about. Next slide, please. So before I move forward, I'd like to maybe talk about discretionary or mandatory spending and the differences between the two. In the context of funding federal programs, we differentiate between these two types of spending because one is related to the way that Congress works on an annual basis, and one is considered related to entitlement programs, much like Medicare and Medicaid and certain programs that don't necessarily need the scrutiny of Congress on an annual basis. Some non-defense discretionary programs will be exempt from sequestration, like Medicaid and other programs related to vulnerable communities, yet some of these are not exempt, including programs that provide care to public health prevention services, those being to improve clean air and clean water, and other public health programs. So discretionary means that it does need the scrutiny of Congress, and mandatory is it's not set by congressional appropriations and mostly refers to entitlement programs like Medicare and Social Security. Next slide, please. So what effect will sequestration have on federal health programs? A report released in September from the Office of Management and Budget, which was almost 400 pages long, tells the effects that the sequestration process would have if Congress and the White House were not able to reach an agreement to avert it. The sequester funds, or the sequester cuts, would slash $2.5 billion from the National Institutes of Health Fund, cut ACA exchange establishment grants, and trim the Prevention Public Health Fund. The Budget Control Act sequester would cut 8.2% from discretionary HHS programs and 7.6% from some of the mandatory programs. So sequestration alone in 2013 would cut $2.4 billion from core public health programs, which will be a devastating blow to a lot of the public health infrastructure that many of our communities work in. Sequestration would also affect many of the programs at the Centers for Disease Control and Prevention and the Health Resources and Services Administration, which fund a lot of the grants to our organizations, as well as to state and public health agencies. There are some good estimates from national organizations like the Association of State and Territorial Health Officials that actually do a state-by-state analysis of what these cuts would mean. Next slide, please. So one place that has the most contention is the estimated impact of sequestration on ACA implementation. While most pieces of the ACA would be protected under a sequestration order according to a report from the Congressional Research Service, the threats to the ACA are present if a deal was agreed to. Some examples of discretionary spending pieces of the ACA are related to how many of us do our work. These are grants related to workforce training and different public health outreach opportunities offered by the Centers for Disease Control and Prevention. These would be possibly reduced by across-the-board cuts under sequestration, and in the case for annual appropriations process may be reduced even more by congressional leaders during their deliberations for spending bills as it related to those spending caps annually for the next 10 years. The mandatory programs that that relate to Medicare, Medicaid, could be used as bargaining chips in the development of a compromise. So even without sequestration happening, we can see cuts to these programs as the administration works with Congress to hammer out a deal. Next slide, please. So one other example that I would like to mention before moving forward, given the recent observation of World AIDS Day, is the effect on some of the HIV/AIDS programming, which provides a vital lifeline for these communities in the age of diminished state revenues. So sequestration is allowed to take effect, an estimated $659 million in automatic spending cuts to HIV/AIDS programs and viral hepatitis programs alone. This report was released by the National Association of State and Territorial Health Directors, the American Foundation for AIDS Research, and the Minority AIDS Council working together. So these are actually very real cuts quantified if sequestration were to happen. And I'd like to turn it over now to my colleagues from the Association of Asian Pacific Community Health Organizations to talk even further about other impacts on health programs.
Well, thank you, Paulo. This is Jeff Caballero, and thank you for the introduction as well. I just wanted to take a moment just to thank NCAPA for sponsoring this webinar as well. As Paulo noted, I just wanted to take a little closer dive, deeper dive into specific impact of the sequestration cuts on health programs that are important for Asian Americans, Native Hawaiians, and Pacific Islanders, specifically how it affects programs within the Department of Health and Human Services. Next slide, please. As Paulo mentioned, the cuts will not impact all programs uniformly. Certain programs like Medicaid and the Children's Health Insurance Program and Social Security are completely exempt from the sequester. Other mandatory programs like Medicare are subject to a 2% cut. Discretionary funds will be cut by 8.2%, while direct spending funds will be cut by 7.6%. The 2% cut, for example, into Medicare results in an $11 billion reduction, which would eliminate almost 500,000 jobs across the country. For community health centers, while the community health and migrant health center programs are exempt from any cuts, the same is not true for the homeless and public housing health center programs, which are at risk of losing $167 million in cuts. In total, as Paulo noted, the government is planning on $2.4 billion in cuts to HHS in general. Next slide, please. Looking more closely at each of some of the key agencies for API Health, cuts to the National Institute of Health would devastate the U.S. government science funding programs, especially for important medical research grants. Cuts to HRSA, as Paulo noted, would undermine Title VII health programs that are key to improving the supply, the diversity, and distribution of the healthcare workforce. The $275 million in cuts to the Substance Abuse and Mental Health Services Administration, SAMHSA, would devastate critical programs that would protect youth and families, including children's mental health services, homeless outreach programs, and youth violence, as well as suicide prevention services. Next slide, please. Within CMS, one of the larger programs within HHS, the across-the-board cuts will set many important programs and initiatives backwards. Sequestration would mean a $66 million in cuts to the health insurance exchanges that are established, the health insurance exchange establishment grants. These are so critical as the states are currently trying to set up the insurance exchanges at the state level. State would also lose access to another $4 million in grants, another $40 million in grants for innovative demonstration projects. The cut to the primary and public health fund is one that the Asian American and Native Hawaiian Pacific Islander community is particularly dreading. It is an important fund. For example, it would eliminate the first national viral hepatitis testing initiative, which was funded with a $10 million grant from the Public Health Fund to the CDC Division of Viral Hepatitis. Cuts to the Public Health Fund would decimate existing prevention programs and halt the creation of new prevention programs across the country. Next slide, please. Paulo had briefly covered this already, and I just wanted to highlight it as an example of specific impact to the Asian American, Native Hawaiian, Pacific Islander community. As you can see in this slide, there is a $196 million cut from the Ryan White HIV/AIDS program, and 1.6 million will be cut from the viral hepatitis prevention program, as I already noted. All of these cuts are going to put to jeopardy more than 15,000 people that will lose access to critical, crucial, life-saving drugs, and nearly 5,000 households that will be losing housing support. I wanted to, the next set of slides are going to be more specific at the state and local level, which I'm pleased to note that Chris Harley will be presenting for you.
Great, thanks, Jeff. So I wanted to apologize again on behalf of Sherry Hirota. She had an unexpected emergency come up and couldn't join us, so I'm stepping in for her. But what we really thought it was important to note the impact of sequestration would have on state level, on the state and local levels, but also to the individuals who would be impacted. And I think that, as many of you are well aware, state and local governments their budgets are very intricately tied to federal financing, and budget cuts that happen at the federal level are deeply felt at the state and local level. And so we thought it was really important to remember and remind everybody that when the Great Recession started in 2007, it really caused sort of state revenues to bottom out to the tune of $530 billion. And since that bottoming out that happened with state revenues, even though they've started to grow, they still remain 7% below pre-recession levels. And these shortfalls on the state budgets have been historically large. And so we just wanted to really focus on that kind of impact and what sequestration then would mean on the state level. So next slide, please. So even as we're talking about how state revenue sources have really just been decimated, we know that state education and healthcare obligations continue to grow. In this coming year, it's expected that 5.6 million more people are projected to become eligible for Medicaid than were previously enrolled in 2008 because of employers canceling coverage and people losing jobs and wages. And so states remain heavily dependent on these federal grants. And in fiscal year 2010, $654 billion in federal grants went to state and local governments, which amounts to 26% of all state and local spending. So these sequestration cuts that we've been discussing are not just going to impact these economies, but really devastate millions of people who rely on these federal grants to support local social service and safety net programs that they're dependent upon. And the expectation is that states would be forced to scale back or eliminate these programs because they don't have the financing to fill in any budget gaps that occur when the federal government withdraws their funding. And so what this slide is looking at and illustrating is that, for example, states continue to weigh their options when it comes to whether or not they're going to expand Medicaid. We know at least 6 states have refused to expand Medicaid. And in addition, states continue to debate whether or not to implement health exchanges on the state. So there's still 10 states that are undecided to whether or not they're going to implement an exchange or have the federal government run an exchange for them. So next slide. And of course, whether or not Medicaid expansion occurs on the state level or health exchanges occur on the state level is an indicator of whether or not people are going to have the types of options that they need to access affordable health care. So that's one of the reasons that we wanted to point that out. But this chart that that is up here was a way to look at some of the key health prevention programs that are funded by federal government and in the 5 states that have the largest Asian American, Native Hawaiian, and Pacific Islander populations. So those are California, New York, Texas, New Jersey, and Hawaii. So across those 5 states, the Asian American population is almost 10 million individuals. And when you look at the impact of the federal budget cuts that are being discussed because of sequestration, we wanted to point it out, what the impact of those cuts would be in financial terms on the state level, but also the number of individuals that would be impacted. So if you look across the reductions that are being contemplated for the breast and cervical cancer screening program, that means $1,498,000 is being cut across all of those 5 states, which means that 5,000, almost 6,000 women would no longer be able to receive the cancer screenings that they need. And so we know already that Asian American, Native Hawaiian, Pacific Islander women are amongst the least likely to receive preventative care screenings. And so then the reduction in these services would likely devastate or eliminate any programs that might be designed to increase access or reach out to these vulnerable populations. And then if you look just at the impact in California, if the substance abuse treatment service, prevention and treatment program were to be hit by sequestration cuts, that would mean more than $19 million is being eliminated from that program, and more than 14,000 individuals would lose the services that they need. Again, Jeff mentioned that for community health centers, it's an unintended consequence of sequestration that $167 million would be cut from the health center program, which would mean that 1.3 million of the most vulnerable and medically underserved individuals in our communities would not be able to receive the health care that they need. Okay, and then next slide. So I also did want to have one slide to point out what's happening right now around the budget negotiations. Everybody's hearing that the fiscal cliff, there's negotiations that are occurring between President Obama and the House leadership. And so this is just a summary of those 2 proposals that have been recently released. President Obama's proposal focuses on $1.6 trillion in tax increases, which is mainly coming from asking individuals who are making more than $250,000 a year to pay more above that income level. It also includes $400 billion in unspecified cuts to entitlement programs, a $50 billion stimulus package, and a permanent solution to the debt ceiling authorization that has been used in the past as a linchpin for budget negotiations. Overall, the spending and savings that he included in his package includes more than $1 trillion from previous spending cuts, and also from savings by ending the war in Iraq and Afghanistan. So that's why these numbers don't quite add up to $4 trillion. On the House side, their proposal includes $800 billion in tax reform, which is mainly from rewriting the tax code, but it would keep the Bush-era tax rates for the wealthy in place. It also includes $1.2 trillion in tax cuts, which leans heavily on entitlement reforms to Medicare, Medicaid, Social Security, which they're trying to get at by raising the eligibility age and potentially putting a Medicaid per capita cap to reduce and moderate spending. The other measure that they have proposed would be to revise the way that they measure inflation on an annual basis to slow that inflation growth. So, you know, we continue to be concerned that conversations around cuts to Medicaid or Medicaid per capita cap are on the table, especially as that would impact, for example, like the reimbursement rate for community health centers, but ultimately would essentially limit and curtail the ability for beneficiaries to receive all of the benefits that they are entitled to. And so, you know, really as health center advocates and safety net providers and generally being concerned about the welfare of the health system around this country, we're very, you know, worried about these discussions and want to make sure that, you know, federal policymakers hear the message that cuts to Medicaid benefits and or shifting the cost to states is really an unacceptable solution for addressing the nation's budget concerns. So with that, I'm going to pass the mic to Shivana, who's going to talk about the consequences on other vulnerable populations.
Can you all hear me?
Yes, we can hear you, Shivana.
Hey. Hi, everyone. So I wanted to take a few minutes to really share in some depth what the fiscal cliff would mean for API women's health, because our health, namely our reproductive health, could be affected in unique ways. So first, I wanted to talk about health disparities, because we know that API women face serious health challenges, right? So there's evidence that we use contraceptives at low rates, putting us at risk of unintended pregnancy and heightening the probability that we'll have to make a difficult decision about whether to terminate a pregnancy. There's also reports, and although there are few, there are reports that the rate at which API women are using abortion services is high, especially among specific ethnic groups, most notably Chinese, Korean, and Thai women. We also know that cancer screening and pap smear rates, which Chris mentioned earlier, for API women are very low, and the incidence of cancer is still steadily increasing for particular groups, for instance, cervical cancer among Vietnamese women. And the last thing that I'll say in terms of health disparities is that there's evidence among API women that we have low rates of condom use and STD screening, so that contributes to a growing rate of some STDs in our community. So given all these health challenges, as you can imagine, the last thing API women need is another barrier to health in form of cuts to the Affordable Care Act or to Medicaid. And we at NAPAWF are nervous that the fiscal cliff negotiations may bring cuts to Medicaid especially, which 6% of API women use and depend on for their health care. And we also know that the percentage of enrollees is even higher than 6% for women in certain subgroups. So, for example, 20% of Southeast Asians rely on Medicaid. Next slide. Yeah. And next slide. Thanks. So particularly Medicaid is something that we're really worried about because it's such a healthcare lifeline for many women in the community. It funds pregnancy and childbirth-related services, pap smears, cancer screenings and treatment, contraceptives, and abortion, although it's only in cases of rape and incest. And these are all things that we know are really important for the health and well-being of API women. And so we're really continuing to watch this and trying to make sure that the negotiations don't end up being out of our favor. And you know, we're also hoping that the ACA isn't compromised, particularly because of the preventive health care benefits that it offers to the women in our community. So I will stop there and pass it back over to Priscilla.
Great. Thanks so much, Shivana. And to the rest of the speakers. So we're doing really great on time, which means that we have the next 20 minutes or so for Q&A. What you see on your screen is a replica of the question box that should be located on your sidebar. So if you have a question that you'd like to ask the speakers, please enter that now, and we'll read them off so everybody can hear and direct them to the appropriate speaker. In the meantime, as you've heard from the panelists, there's a lot at stake, and so obviously if Congress doesn't act soon, we will be facing a situation where both on the national, state, and local level. Going over the fiscal cliff will have serious implications on our public health and our health programs and our health systems, beginning in 2013 and for many years to come. So, okay, I'm sorry, we're having a little bit of a technical difficulty, so we're going to actually just move on to the next slide. Also just take a quick moment to plug a National Capacities webinar, which is also a joint webinar with NCAPA. That'll be taking place tomorrow at 1 p.m. Eastern. We will send out registration information as soon as this webinar is completed, so you can participate in that one as well. But we are back online and ready to take questions. Well, as folks enter their questions for the speakers, I guess I'd like to maybe ask our panelists whether they have any predictions or ideas on what might happen in the next, between now and the end of the year. Does anybody want to venture?
Well, I don't know if I have any predictions, but I do want to urge the folks that are on the call to really take the next couple of weeks to, reach out to their legislators, provide, get their members to reach out to legislators and really have your voices heard and tell folks in Congress that, making these cuts on the backs of the vulnerable is really not the right way of adjusting the budget shortfall. I think this is really starting to be crunch time, and we just learned that the House is expected to be in session during the week of December 17th, and so really these next 2 weeks are going to be key in getting the voice from the public heard in Congress as the negotiations that are occurring around sequestration or avoiding sequestration really come to a head.
Yeah, I just wanted to, really highlight what Chris noted again. It's really important to remember that all of this is avoidable, and that our community must be very vigilant and monitor the budget talks in the next couple of weeks. Everyone, but particularly us, for example, in NAPTRO, are really working hard to clearly communicate what our priorities, like the prospective payment system for health centers, are really understood by all our members of Congress and are protected. And I encourage all those in our communities who have comparable interests in their areas to do the same.
Yeah, I think those are really important points, Chris and Jeff. And we know from a national public opinion poll that was conducted during this current election cycle on Asian Americans and Pacific Islanders that there's actually a lot of support for raising taxes on high-income earners. The opinion poll showed that 67% of respondents, these are again Asian Americans and Pacific Islanders, with households, 67% of all respondents and 63% of respondents with household incomes of more than $250,000 said that they support raising taxes on high-income earners to reduce the deficit, which is also the position that the president ran on in his campaign. At the same time, it's important to note that close to 1 in 4 Asian Americans and Pacific Islanders also reported being worse off now economically than they were a year ago. So, these issues have very real impacts on people we know, on our families, and on our communities. They're tough decisions, but at the same time, they are issues that our community is very much invested in and will be tracking very closely.
And I think this is Paulo from the Health Forum. It's very important for us to actually contextualize a lot of how, in our messaging with our partners, how everything happening in the fiscal cliff affects every single person. In the past, I think most people think that they don't know anyone affected by a lot of these programs that will affect vulnerable communities, but I think looking at it from a fiscal perspective, this will affect everyone who has been affected by the Bush tax cuts and other tax policies in the past decade. And so these are radical changes which, at the expense of deficit reduction, will the Congressional Budget Office and many other analysts predict create more of a, or prolong the recession, or a feeling of the recession and the effects of it on our economy. So I think this is one of those main messages that we need to let members of Congress know. We've seen that the House of Representatives and the Senate have not scheduled any floor time or any discussion on any of these proposals, so there still is time to do it, especially with less than 1 month left until Congress recesses. And we were delighted to see that Majority Leader Eric Cantor in the House of Representatives decided to postpone the congressional recess for the holidays until they, and causing everyone in the House of Representatives to stay in town to fix this until it's done. So there's still added time in the Congressional calendar to do this.
So, Paulo, Chris, and Shivana, you all mentioned how important the Medicaid program is for Asian Americans, Native Hawaiians, and Pacific Islanders, and also mentioned how it is an entitlement program that has come up time and time again as a possible bargaining chip in reducing the debt and the deficit. Could any of you guys comment on, Chris mentioned the possibility of a Medicaid per capita cap, but are there other scenarios that we should watch out for in terms of restructuring Medicaid or similar proposals that those of us who care about low-income communities should know about?
Yeah, I mean, I think it's hard to say because there's obviously nothing's been set in stone yet. I've heard a lot of concern about there being a process for block granting, either Medicare or Medicaid. Oh, is that me?
Uh-oh. It went away. Go ahead, Chris.
Okay. And so obviously that's another kind of way of sort of arbitrarily setting a ceiling on the sorry, I don't know if it's me. But yeah, of arbitrarily setting a ceiling on the spending, but which means that at whatever limit the federal government sets, that would pass those costs on to either states to pick it up or onto beneficiaries themselves to pick it up. Other things that, were noted was the kind of efforts to extend the eligibility rate, which or eligibility age for Medicare or Social Security, which again is just going to put an increased burden on those that are low income, that are more dependent on these kinds of entitlement programs that they've been working for. And so I think those types of options that are on the table right now, that both the White House has signaled that they're open to, and the House leadership has been pushing for, means that this is something that without advocates really speaking out and making sure that they understand the consequences of those types of cuts or limits to spending really have such a detrimental impact on those that are most dependent and most at risk for a loss of services.
Thanks, Chris. Any other comments?
Yeah, I think one thing to also consider around Medicaid is it's not necessarily just the decreases or passing the burden of the Medicaid program onto the states through block granting. I think everything is on the table in terms of deficit reduction talks with some conversations around, as part of the ACA, increasing Medicaid payments to primary care physicians as a way for physicians to get more people into, or to see more people with Medicaid as a way to incentivize this new population with Medicaid expansion, using that as an offset for some of the deficit reduction proposals instead of it being active as part of the overall package of ACA. And so there are some things that are also under the Medicare and Medicaid purview, like the Center for Medicare and Medicaid Innovation, housed at CMS, which is tasked with finding ways to increase quality and lower costs in the overall program, and using that pot of money to also offset a lot of the pieces, just to come up with some kind of discussion, which we've seen in the past actually has been done, not with these two funds, but in terms of what happened this past year with the Prevention and Public Health Fund, decreasing the payments by $6.25 billion over 10 years to offset the costs of unemployment insurance extension and the Medicare doc fix. So we just have to be very cognizant that nothing is truly protected unless we actually see a plan, and at this point we haven't seen any viable plan being passed by both chambers.
Yeah. Oh, sorry. If I can, I think I would be remiss if I also didn't note that one of the things that community health centers in particular have been really watching and very concerned about is a potential for having the Medicaid reimbursement rate to health centers be eliminated or cut, which would really devastate the ability of our member centers to serve the most vulnerable patients that we see, which, you know, we see a significant number of patients that are either uninsured or underinsured and lack that kind of access. And so, you know, that's something that we really want to make sure that doesn't happen.
Yeah, Priscilla, I mean, I think what's most important, you know, there's so much details and numbers and politics that are being noted, and what's really important for our, you know, what's really important for our communities to remember, and is that this isn't just about crunching these numbers or these politics. There's a lot of livelihood and people in our communities' health, you know, that are concerned. There's a lot at stake, and people just need to remember and include in their message that the November election was very clear. A broad coalition of Americans, including Asian Americans, Native Hawaiians and Pacific Islanders, spoke clearly. Congress and the administration need to work together and forge a balanced budget to ask the wealthy to pay their fair share and invest in our communities. That means plain and simple, and we shouldn't overcomplicate the kind of actions that people in our communities can take in the next couple of weeks.
That's definitely true, Jeff. I think, you know, to maybe follow up on something that Chris mentioned earlier, I'm sure folks on the phone and participating in the webinar, we're all concerned. Is there anything that we can do as advocates, you know, in addition to calling our members of Congress? Are there any other suggestions on how the advocates can get involved and try to, you know, move the conversation forward?
This is Paulo from the Health Forum. I think it's really important for us to use a lot of the 21st century tools at our disposal, really around social media, to create kind of a buzz for sharing personal stories, and I think this has been successful in past fights like the deficit ceiling last summer and other important legislative pieces, because I think right now it's such an accessible piece of technology that many of our members and our communities that we serve have access to or can do. So I think a very good use of social media and coordinated efforts between organizations or the people who lead organizations on this call can be done in the next couple of weeks.
Mm-hmm. And as Paulo noted, with all this social media stuff, my understanding is that there are already thousands of people that are using the hashtag MyY2K on Twitter and talking about what the loss of these vital health services mean to them, or how a 2000 tax hike would affect their families or their decisions of paying the rent or going to see a doctor.
That's right. Can somebody say some more about what that campaign is, My2K?
Yeah, so this alludes back to what Paulo had mentioned earlier during his presentation about if all of the Bush-era tax cuts are eliminated, that and on average, middle and lower income families would see about a $2,000 tax hike starting next year. And so the effort is to try to help folks in Congress understand what a $2,000 tax increase would mean for the average American. And so using hashtag My2K, the White House is asking for those stories. What does it mean? What does $2,000 mean to you? How does that impact your ability to pay rent? How does that impact your ability to buy groceries and things like that? And so the more stories and the more personal stories about what $2,000 means in daily lives, it's just another way of getting your voice out there and letting folks in D.C. know that, again, I feel like these conversations around billions of dollars just seem so abstract. But what it really gets down to is day-to-day livelihoods and abilities to provide for families and, get to work and things like that. And so we wanted, so that hashtag My2K is in an effort to tell those stories and get past, sort of the political rhetoric that just happens in negotiations in D.C. and really to the realities of what folks are facing.
Mm-hmm. Thanks, Chris. Yeah, and for folks who are interested in participating in this social media campaign, hashtag My2K, the Health Forum has also developed some sample tweets. So it's really easy. Even if you've never tweeted before, you can open up a Twitter account in probably 5 seconds, or use your Facebook page, and all you do is enter the hashtag My2K, and we can provide some sample language for you to generate your story. Of course, if you have a personal story, that always makes the most impact, and I'm sure the administration and our president would appreciate, any story that illustrates how burdensome an additional $2,000 in health-related costs or any other related costs would have on Asian American, Native Hawaiian, and Pacific Islander families. So we just have a couple minutes left. I think we'll just ask the speakers if they have any closing remarks.
This is Shivana. I think that for us, it really comes down to values, right? Who is it that we value and don't value in this country? And I think that, right now with the negotiations, there's an opportunity to say, yes, everyone should pay their fair share, and we're hoping that there's progress there. And if there's not, then it means that those of us that, don't have lots of means are less are left to suffer, and it shouldn't be that way. So I just think, really thinking about what our values in this country are.
Great. Thanks, Shivana. And
Hi, it's Jeff, and my closing comment is just that community mobilization is important not only during the election, and I just wanted to emphasize that, folks, that sequestration and budget cuts discussions are all avoidable, and we just need to hold our members of Congress accountable and hold their feet to the fire. So contact them and let them know how you feel.
great.
I think the last thing that I will say is this, a lot of the messaging and a lot of the facts that we're presenting are also available on our website or different talking points. So please, for those on this call, please visit our reorganization's website. And once this webinar is available, to pass it on to your friends and colleagues and neighbors.
I'll just say thanks, everybody, for joining the call.